Richard and I recently had the pleasure of sitting down with Bear over breakfast before he had a meeting at the Prostate Cancer Center. Bear is married and resides in Vancouver. By default, I guess he's automatically a Canuck fan. And despite that, Bear is successful co-founder and CEO of Osbon Medical. And we're lucky that they're not playing tonight, or we'd be looking for another speaker maybe. Osbon Medical is focused on men's health as well as the most commonly diagnosed cancer among Canadian men, prostate cancer. In fact, if you go to the company website and look into their research tab, you'll find a prostatectomy guide, which has a wealth of information. So with that, we're going to say, go Canucks, go, because for some of us, it's anybody but Edmonton. So go Canucks, go, and I'm going to turn the screen over to Bear.
Awesome. Thanks for the intro there, Brad. For the record, I'm actually a Flames fan, but so, go Flames. But I am cheering for the Canucks now because, anyone but Edmonton. So, but I do reside in Vancouver. This is true, and big hockey fan. Too bad the Flames didn't make the playoffs this year. Like Brad mentioned, appreciate the intro. Met with Brad and Richard when I was in Calgary prior to meeting with the Prostate Cancer Center there. I'm going to share my screen and we'll get right into it. I'm going to present on vacuum therapy for penile rehabilitation, and we'll save the questions for the end, and then I'll open the floor for questions. A quick disclosure, this presentation is made by Osbon Medical Canada. We make and distribute the vacuum erection devices and other sexual health products in Canada and the US. Quick background on myself. I worked 7 years in healthcare management, used to be operations manager for a group of pharmacies, and took over the Canadian division of Osbon Medical, also known as Osbon Medical Canada, 2 years ago. Kind of serendipitously, but just noticed a big gap in men's health that needed to be addressed. We have made our way across the country, meeting with all of the main men's health urologists and getting their input. This presentation is accumulation of their input, and then eventually we put together a medical advisory board to make sure that everything scientific related was accurate. Because education is key. I actually just got back from the American Urology Association annual meeting in Texas, which was 2 weeks ago, and that was super interesting. And there was actually a lot on vacuum therapy for penile rehab, which is becoming more and more of a mainstream term. So the presentation, one of our big things, we get a lot of feedback from cancer survivors, meeting with support groups like yours, about the lack of support from surgery to recovery, the lack of centralized education, and then of course the lack of access to devices and products, which is something that we're trying to address first, and then move into the education and move into the support. So you'll see more and more as we continue to tackle those other ones. For now, it's bringing high quality products that are medically approved, vetted by the experts, and make them accessible. So table contents, we'll go through a quick intro on human wellness, what is vacuum therapy, radical prostatectomy and ED, and then the importance of penile rehab. I'm going to play an 8-minute video on how to use a VED by a sexual health educator who's now retired, but he made this video with Prostate Cancer Canada, formerly Prostate Cancer BC, about 5 years ago, and it's really good. And I think he does a better job than I could. And then we'll talk a bit more about combination therapy, and I'll mix in some studies throughout. We'll kind of just breeze over those studies, but I'll have the main points highlighted. And again, that's from our medical advisory team. So a collection of urologists and sexual health nurses across the country. So human wellness, this is World Health Organization, kind of the 8 dimensions of human wellness. You notice there, one thing they're missing is the 9th dimension, which is sexual well-being. For whatever reason, there's been a stigma around it. but any urologist and then a mental health practitioner will tell you that when the sexual health pillar is not functioning, that does affect everything else, especially the mental health and the well-being. So what is vacuum therapy? It's kind of the reason why we're here for this presentation. From a sheer physical perspective, it's the negative pressure to bring blood flow to the penis in a safe and effective way. It's drug-free and it creates an erection in 90% of men. Everyone asks, what is that 10%? It's usually those who might have blood clot issues or more like niche conditions. And then the two terms that we'll use, VED is a vacuum erection device. So that's just the device without the constriction rings. And then there's VCD, which is a vacuum constriction device. You're using the vacuum plus a ring to keep the blood in there. The reason that the two are differentiated is a lot of the science now is kind of getting away from the whole sex tool and more of a rehab tool, where this is a physiotherapy device, for your penis. It's a gym, it's a rehabilitation tool, and the sex can come later, but that's something key that we'll be focused on, especially when it comes to the studies. So vacuum therapy with a VED, the standard kind of protocol is, if you want to use constriction rings, no constriction rings for at least 2 weeks. As I mentioned before, it's like daily physiotherapy. It increases the blood oxygenation. Studies, we'll cite those studies later. And that's very key post-surgery for recovery. And then, again, the constriction device is added later. I just had a debrief with our head sexual health nurse. Her name's Christine Zarowski. She heads up the prostate cancer supportive care program in Vancouver. One thing she wanted me to emphasize is, she couldn't join us today, she's on vacation, but she wanted to emphasize is when you're using the device, the first even a week, you're not creating full erections. It's all about slow and steady. And especially when a lot of patients she sees, they haven't had an erection for months, sometimes years. And you're not just gonna use this device and create a rock hard erection right off the bat. Even though you theoretically could, it's not really, it's not safe, and you're not gonna like injure your knee and then just all of a sudden start sprinting right away. So something to keep in mind. So the history of vacuum therapy, I always like to get into where it started. I mean, it's over 150 years old as a sexual function modality. It did take a big back seat when PD5Is, which is the medical term for the drugs like Viagra, Cialis, Sildenafil, etc., when they became mainstream, just because they're much more convenient, and doctors just found it way easier that, oh, this pill works just the same, and it's way easier to do, way less back and forth with the patient. Over time has shown that that's not the case, as it's using a completely different mechanism to create an erection. It's far more expensive and comes with a lot of potential side effects. So in 2010, that's when studies really started to, you saw this huge resurgence of the vacuum erection device. That started around 2010 when it started, what the resurgence did. So this was one of the main studies, or this is one of the marquee ones, where just emphasizing that VED therapy is a centerpiece for prostatectomy protocol or post prostatectomy and pelvic injuries. Vacuum therapy being an indispensable modality. So yeah, the return, its efficacy is high. There's no serious side effects, drug interactions, and then it's the combination aspect as well. So doctors started to say, okay, we can use the pills and the vacuum device. We can use injections and the vacuum device. So it gives them more flexibility. One thing to keep in mind, if there is combination therapy, it's important to note that it should be overseen by your doctor and documented. So yeah. So radical prostatectomy and ED, this is a slide from our nursing team. 4 main causes: nerve damage, structural tissue damage, cavernosal oxygenation, and arterial damage. I won't get into this too much, it's not my domain, but just some context. So this is another pretty marquee study of the early use of vacuum erection device following a radical prostatectomy. Rupesh Raina is one of the leaders in the field. Again, from 2010, this study where it's recognizing that vacuum therapy, VED, is having a primary role in early penile rehab, specifically those for prostate cancer. Study from 2014, this one, again, very key about the penile oxygen saturation before and after, and how the VED, without a ring, just the VED, again, used like a rehab tool, used daily to bring blood flow on a regular basis, results in significant improvement in penile oxygen saturation. One of our goals when we brought the Osbon vacuum erection device and these medical grade VEDs to Canada was, to make vacuum therapy accessible to all Canadian men. Prior to that, it was, had to be ordered through the States, duties, loopholes to jump through. So now we have our warehouse in Vancouver trying to make it super easy. So one thing about prostate cancer as a disease is that it's only becoming more prevalent. And I mean, it's overall a good thing. The increase in detection in younger men is good. The survival rate has gone up. We're all talking today, many of us prostate cancer survivors. So we're seeing this shift though from mortality management to lifestyle management. The bad thing about that is that many men, I mean, it's kind of one of the drawbacks about men is that we suffer in silence by choice, and that's something that isn't healthy. And we're looking at ways to increase that dialogue. And I think Brad and his with Prostate Calgary is groups like this are super important. So back to penile rehab following radical prostatectomy. Like we mentioned, there's the inevitable nerve damage during a radical prostatectomy. Early intervention is proven to be crucial. Don't worry too much about that. It's one of our most common questions we get. Our medical team always says it's never too late to begin vacuum therapy. It's just you need to wait until after surgery, your acute damage, your inflammation, everything around that region is ready for the pressure of a vacuum. But we get a lot of questions where customers, patients will be like, oh, it's been 5 years, is it too late? So it's never too late. It's like it's never too late to work out, it's never too late to begin an exercise protocol. Think about it like that. And it's bringing that oxygenated blood flow to that region on a regular basis. And another important thing is that it helps to preserve both length and function. So how it does that is studied in 2009 from the IGIP or IGIR. Is one of the keys of the VED is that it's able to draw blood into the penis regardless of nerve disturbance. So it's not using nerves to stimulate to then use the brain to get stimulated and bring blood flow. It bypasses all of that. So it's become a centerpiece for penile rehabilitation protocols. If you think about not having nocturnal erections or all sorts of other factors that could prevent the mental aspect, it's mechanical. And that is also one of its drawbacks, I'll be honest, is that it is mechanical, but it's also a benefit. So it's one of those things. And then another common question we get is the penile length after radical prostatectomy. Again, many men don't like to talk about it, but it's a medical condition. They even use the term turtling, where it's because the prostate gets removed, everything gets pulled back. So you need in this study from 2007 showed that daily use of VED helped to preserve penile health and length after surgery. Sorry if I'm moving kind of quick here. We got, don't want to spend too long on any particular study. And yeah, this one from 2007, German study, was initiating the use of a VED protocol at 1 month, improved early sexual function, and helped preserve penile length. Again, don't worry too much about the actual, the urgency of starting it. It's never too late either. So I was going to play a video here, and this is an 8-minute video. So now we've talked about the background of it. Now my friend Lou Ryu is going to show how to use the device. He's using the Osbon Erection Steam manual. It's the kind of the main one that we use, especially with post prostate cancer. There's that and the automatic. And yeah, we'll hop into it here.
One end has a manual pump. You can get battery operated one for the guys if you have mobility issues. No problem, we can take care of that. Then you have the tube and an insert. The one thing you're going to use a lot of, and that's going to be a water-soluble lubricant. Don't use Vaseline, don't use butter, don't use anything. It has to be water-soluble, okay? On the tube, there's a little window and there's a marking. You have to lubricate inside, all the way around. You would put lubricant on the outside here, and you lubricate the head of the penis. You don't have to do the shaft, just the head of the penis. Then I tell most guys, shave the pubic hair. Do you have to shave it all off? No. But here's the problem. If you shave a little bit, and there's any hair gets over here, you can pump all day. You're not going to create a seal. So I tell them, shave, and as it comes back, you'll know the length. Now, if you really don't want to shave, you're going to pretend you're decorating a cake. See the end here? I said you lubricate. Take some more, like an icing pen, and a real thick ring of the water-soluble lubricant goes around. Penis, this is the floor of the pump. We'll call this the floor. Penis goes in, and as soon as you put your penis in, you back and forth rock it to create that seal. You don't want the air. Then you would start 2 pumps and wait 10 to 15 seconds. You need to give time for the blood to come through the veins. After 15 seconds, 2 more pumps. And you'll see some things happening here. Now here's what you look at. Watch the penis. If all of a sudden you finish the second time, the pump, and the penis going back, the blood's coming back out, you don't have a good seal. Okay? So take your time. This is important. You must take your time. If you rush it, you're going to get some problems. I'll show you. So every 10, 15, could be 20 seconds, 2 pumps slowly. Don't pump fast and don't go too slow. Okay? Until you get that erection. Now this is what we call an erection. You're not going to be looking down this way at it. I want the guys to first learn by standing in the bathroom sideways looking in a mirror, because this is what I want you to see sideways. So as soon as you have an erection, this is the erection. Keep pumping until the penis comes off the floor. Stop, because if you pump more, you're going to damage the veins. So as soon as it comes up, you stop. I'm asked, how many pumps will that take? Every guy's different. You tell me the size of your veins. It's different. So that's what you do. Now, if you have not had that erection for over 30 days, some guys I've had 10 years, 15, 25 years, we have to practice. Remember, you have to get that penis used to taking that pressure again. So here's what we do. You get that erection, you would maintain it for about 2 minutes. At the end of 2 minutes, you would push the button at the end. This allows the air in and the penis becomes flaccid again. You would wait 1 minute and do it again. You would get that erection up and down 4 times. At the end of that, you put it away for the day. That's your homework every day for 14 days. Now, on day 15 is when you would start introducing the ring, or as I call it, happy day. So, you use this little cone. There's a little white dot at the end. That matches the same size as the handle. All this does is put the ring, it's an applicator, it puts the ring onto the tube. Then, remember this, you're going to go through a lot of this, okay? Lubricate the cone all over. Then you would get a ring. We're going to apply the ring. I'm going to cover the rings in a second, but let's just say we put this ring on, okay? You can tell that white dot is also where it goes at the cutout. And now the cutout here is the urethral cutout. That's the bottom of the penis. That's where guys would urinate from. We would ejaculate. If you didn't have the prostatectomy, that's where it goes on right here. Then this thing just pushes the ring over the cone onto the unit. Now, if I did it now, I would probably break the ring because it's no lubrication. It's no lubrication whatsoever. So let's take this off and pretend it's lubricated. All you do is push down. That's it. Take it off. The ring is now on here, okay? Get that erection again, and once that erection is there, you would push this ring off onto the penis. Great. Now, you have that erection, it rings on your penis, you have it, finally. You see this erection, it's great, and all of a sudden, within 2 minutes, you think, wait a minute, my erection's going away. What's going on? Why is it going down? It's not strong enough. The only differences between guys is we all have the same parts. But I don't know what your veins are like in your penis, and neither do you. You may need higher tension. So we would go, instead of a beige ring, to this pink ring, the B ring. So you've got the ring on saying, this is great. 2 minutes later, and my erection is being maintained. I love this, it's great. And you're having fun. And 5 minutes, 10 minutes, all of a sudden, hey, wait a minute, it's going soft. What's going on? Something's not right. Again, it's the wrong tension. So then you would have to go to another ring. And right away, guys tell me right away, Lou, hold on. This is a smaller ring. I went, yes, that's correct. And I say, well, I don't want to brag, but this ring, well, my penis is larger than this ring. And I say, really? Well, this ring goes over this opening. Is it larger than this? Okay, we have your tension. The reason it's smaller, it creates a higher tension. You don't know the size of your veins. That's it. Some guys will have to do 2. So if they do 2, they have to use a higher tension, the pink, and then the white. The higher tension is always nearest the body, and the beige one is away from the body. That maintains it. And then we have other options because, again, we have the same equipment, but every guy is different. When you're using the pump, all of a sudden what could happen is, as you're trying to get the erection, around the penis you'll pull in extra skin tissue, the fatty tissue, the muscle, all that stuff. When I was young and buff. Okay. So the other thing you could pull in is a testicle. Now, if that happens, you'll only do it once. That's all you'll ever do it. So I tell the guys, if that happens, after the blood-curdling scream, push the button, let the air in, and slide it off. Now, you would use an insert. The insert is designed to keep that extra tissue away. You just want room here for an erect penis. That's it. And a little bit of room to slide this off. That's it. This may not be enough. If that's not enough, you'd have to go to another insert that goes inside of here. It's a different insert to make it smaller. If that isn't work, and sometimes it doesn't, we have to change to a different type whatsoever. That's the ring, just like that. The head of the penis, remember, you have to still use the lubricant, sits here, and as you pump, it'll eventually pull in your penis with the erection. Boom, just like this. There you go. There's the ring on the penis. You have 30 minutes. Doesn't matter which ring, you have 30 minutes. Now let's talk about the rings for a second. In the kit, there's actually 4 rings that come with it. 2 beige, 2 pink, 2 low tension, 2 high tension, 2 larger rings, and 2 medium rings. Large and medium. Yet they don't make something called small, because when it comes to our penises, we don't talk about small, right guys? Sorry, it's got to be. So it's medium. They're different tensions. That's all it is. A, B, C, and D. So you've got the ring on. It's on your penis. Remember now, you have how long? 30 minutes. How do you get the ring off? Pull the little the wings at the side here, just like this. Don't pull it all off. You'll break them. Just hold it like this. You release the pressure off your penis, and the blood will flow from your penis back into your body. Slowly wait about 10-15 seconds and slowly slide it off, and you're done. Wait for 1 hour. Go again.
Okay, so like Lou mentioned, practice sessions, no rings at the start. He does a good job. Spent 2-3 pumps, waiting 5 seconds, and repeating until the erection is achieved. That should be noted that you're not going to necessarily create an erection the first few times, maybe even the first week. It's very much feeling it out, and that's where that release valve is there. Any discomfort, you release it, and you start over again, and you got to build up to it. These are just some snippets of from the manual. This is my plan B. If that video didn't work, then I just have to explain it as I go through from the manual. Note that there's hair in there. There should not be. We gotta get that updated. So yeah, like Lou mentioned, adding the tension rings. It must be at least 2 weeks before you begin to add the tension rings. Even use the tension rings without intercourse at the start. Just get used to holding that erection, see how it works, then figure out, like you mentioned, which tension ring is the best one for you. Another thing to note is that a lot of patients might use 2 tension rings. 2 different ones even. It's very much, everyone's anatomy is different, and the 2 tension rings spreads out the tension. The one that he showed at the end there, if you get the scrotal tissue being sucked in, that's called an easy ring. It doesn't come with the kit. It's separate, but definitely used by a lot of, especially post-radical prostatectomy patients who might have, a shrinkage going on and need that extra buffer. already talked about this. And yeah, this is a really good table from a comprehensive study on VEDs done at a hospital in Ireland, a university hospital. Now, they do a good job of capturing the advantages, quick to use, reliable, non-invasive. Our sexual health nurse, Christine, really emphasizes incorporating it into foreplay, bringing the partner in and using it, and not just being like, oh, I'm going to use this device on my own in secrecy and then put this tension on and then go for it, because she really, and when she works with patients in Vancouver here, it's like bringing the couple in, and like the woman's involved, and it's key because the mental side of intercourse is so key. And yeah, the Osbon and the PTV automatic both come with 5-year manufacturer warranties, and it's a one-time purchasing cost, which is nice, and very few contraindications. Disadvantages is, yeah, it can create a cool erection. There can be some constriction with the rings, preventing ejaculation. It can be a little painful if done too fast or too vigorously. It is, it's bulky. It's got lubricant. It can be, a little bit cumbersome. And then another thing is it creates a bit of a different erection when using the tension rings. Something to keep in mind. A lot of practitioners call it the hinge effect, where you have a hard shaft of the penis, but then at the base where the ring is, behind that can be a little bit less hard, so you want to guide the penis in. We have a lot of good resources and videos on our site done by product experts, practitioners, addressing all of these. This is one really good one called Overcoming the 5 Common Issues with VEDs. I'll share that as well as the video that Lou just did there. Combination therapy can become a really popular modality over the last 15 years, since about 2010. Excellent way to address those who don't respond to PDE5Is or have a lack of efficacy in either PDE5Is or VEDs alone. Study done this is from 2009. It's just supporting the use of PDE5s with VEDs in men in whom PDE5Is alone failed. And it's a great therapy to be tried before more invasive alternatives are considered. So last, we like to follow or finish with the actual VEDs that are out there. This is probably the single most common question we get is, what is the difference between the penis pumps I see in sex stores and then a medical grade VED? So obviously the penis pumps you'll see. This is one of the most common ones on Amazon. It has a lower price point. I think it's around $100. It's cheaper because there's no FDA approval. It's not classified as a medical health product. It's classified as a sex toy, similar to a vibrator. It's and then the big thing that makes the medical, and there's no vacuum limiter valve in here, so it's going to create, you can keep pumping and it's not going to stop. And we see that a lot where it's actually more on the flip side, where these lower grade pumps, they don't create enough pressure, and then a patient will go back to their practitioner and be like, yeah, the vacuum therapy didn't work for me. Now, when you're using a medical grade, a much higher price point, this is the Osbon Erecade. It's FDA approved, class 1 medical device in Canada, and it has that vacuum limiter valve, which prevents it from creating an unsafe amount of pressure. So it's going to create a lot of pressure, but that limiter valve will prevent it from creating too much pressure. It'll just stop creating it. And it'll still be, you'll still notice that pressure, and then it has that release valve as well, which is key when using it for vacuum therapy. And then it does come with a 5-year manufacturer warranty. So to sum up, we do a lot of work, and we continue to support the prostate cancer programs across Canada. And we, with Prostate Calgary, we created a promo code. So if you use prostate in the purchase there for any vacuum erection device, so the manual or the automatic, you'll receive $15 off your VED purchase. And that is all for now. I'll now open the floor to any questions.
The difference between this and say some of the other implants, surgeries, devices, anything of that nature, the injections.
Yeah. So the nice thing about the pump is that it's non-invasive. So when you look at the hierarchy of modalities and how invasive they are, the pump is right there with the pill, where something you can try, and if it doesn't work out or doesn't fit your lifestyle, then you kind of move on. The thing about the surgeries, especially with an implant surgery, is there's no going back. Once you choose an implant, that's it. Like, you're not going to take that implant out now. You might, but it's not common practice. And so Dr. Baberstock, who's the main implant guy in Calgary, well, him and then Dr. Josh White does a lot too. And they're starting to get more and more patients on the pump, trying out the VED as an ED tool. And then now the literature actually points to using, if you say you really want to get an implant, you can use the VED prior to the implant to restore length, and you put a larger implant in. So the long answer to that question is that it's non-invasive and something to try before doing something more permanent like an implant. And it's also a modality that can be combined with almost any other one. You're using it before an implant surgery. You're using it with the oral pills. You can use it with injections. Injections obviously a little bit more invasive, because you're putting an injection into a very thin capillary of your body. But yeah, I hope that answers the question.
Yep.
There's one from the chat, Brad, that says, how much are you talking about for the device following?
Yeah.
Oh,
These
okay, you got that.
These are the real questions, eh?
Yeah.
Let me just bring it up here real quick. So the manual, like all in with tax, then, hey, let me just see. Yeah. What? Let me see what the tax is in Alberta. Is that 5% or 10%?
5%.
5%. Okay. So the manual, the one that Lou had there, is going to be $459 with tax. Shipping's free. With tax comes to $482. And then the automatic, a little more expensive, the battery operated one, comes to $618 with tax. The next question, I'll do it proactively, usually get it, is, do I get any coverage? So the government in Canada, unfortunately, does not at the moment. We're trying to change that. But some third-party insurance, Blue Cross, depending on your plan, it's worth submitting, especially for post-cancer. We've seen it's usually on a case-by-case basis. And yeah, we've just gotten approval with Veterans Affairs Canada. So that one is approved for the purchase of a device. But again, it's case-by-case. So we're trying to promote that more and more.
And then I guess where the comparison would be to how much are they spending on pills or injections that may not be covered.
Yeah, for sure. So I'll share something real quick here. So this chart here, you can see this is based on, this is a few years ago when the pump system was a little cheaper. It was $420, whereas the average price of a pill per pill is $18.50. So you're looking at about almost $2,000 a year if you're using it multiple times a month, the pill. Whereas tension rings are a lot cheaper. So you look at this chart, by year 5 with the Osbon, if you're replacing your tension rings, you're in it for about 1,000, whereas you're pushing 10,000 with the pills.
Yeah. So
yeah,
when you do that direct comparison, more economical in addition to being less invasive.
Yeah. And I mean, to add to that, we've talked to several patients who use the VED to augment and combination therapy with their pill, and they essentially use the pills less. So they're saving either way. They'll be like, oh yeah, I use my VED on a regular basis for penile rehab, increase blood flow, and then I'll use my oral pills solely when it's anniversary night or date night or something like that, where they want to have penetrative sex.
The question, Bear, was, is there a minimum length for using the vacuum?
No minimum length.
and based on what I saw, there's no maximum either.
It's rare.
It's FDA approved. The question, I guess, Bear, is it approved by Health Canada?
Yeah, it's a class 1 medical device by Health Canada. So we have the certifications, but coverage is harder because
Yeah.
Canada doesn't recognize ED as unfortunately, as a coverable condition, whereas in other countries, UK, Germany, Norway, all do. So yeah, that's what we're battling with. That's our other, mountain we're trying to climb, is get this covered across the board, at least with province by province. So
That's looks like it for questions, Barry. You must have included everything in your presentation.
well, I mean, it's been about a year now, so whenever I get common questions, I'll work them into the presentation. So
Yeah.
when I started out, it was about half and half, presentation and questions. So that's good.
Perfect. The best way to buy it, is it
Yeah.
online?
Online, Osbon, and I'll send a follow-up as well.
Yeah. Well-
Osbon.ca.
Good. Well,
All right.
if there's no other questions, we're going to let you go. Thank you so much for your time and the great presentation. I always learn something new when I get to host these events, so we appreciate what you're doing, and you can count on us to continue to support and getting that coverage. So we
Yeah.
will be an advocate for that.
Sounds good. Thanks, Brad. And
Okay,
go Flames, and then go Canucks. Anyone but the Oilers.
yeah, anybody but the Oilers, good.
Anyone but the Oilers. All right. See you guys. Have a good night.
Okay, thanks, Bert.
Thank you.